morning everyone, myself Nalini Mangela. I would be explaining about the community group we selected for this assignment. So we selected the group of internationally educated nurses who are newcomers at Seneca as a community assessment. We selected this group because there has been increasing number of international educated nurses every year at Seneca, and the parameters which would be done for the assessment are: we would assess their credential, their capabilities, their cultural equity, and their capacity to deliver healthcare within the neighborhood. At Seneca College, there are a number of various nursing programs which are delivered, such as chronic disease management, nursing leadership and management, coronary care nursing. So, international educated nurses are attracted towards including themselves in the Canadian healthcare system. Nurses from Philippines, India, Middle East, Africa, these all collaboratively contribute themselves to join in the Canadian healthcare system. Hence, for the development of healthcare system in Canada, we need to assess international educated nurses to make sure they are competent enough and possess enough knowledge, skill, and judgment so that they could practice safely in Canada.
The assessment to include in order to meet the needs of the future development of the community are: number one is assessment method. This is by doing surveys and interviews that will focus on the most vulnerable people in the community to assess their input. Number two is asset and resources analysis. This is by mapping the organization and talented people that makes up the community, investigating collaboration with nearby companies and charitable organizations that can contribute, and figuring out the material, human, and financial resources that are available. Number three, stakeholder engagement. This is to encourage cooperation among leaders, institutions, and public servants. Communicate often to facilitate inclusive and decision making. SWOT analysis. This is to evaluate communities' strengths, weaknesses, opportunities, and threats. This is to enhance what works, fix what does not, and look for areas for improvement. Number four is digital integration. Make use of digital tools of teamwork, communities, and data gathering by using social media, have virtual meetings, conduct online and service, examine cutting-edge technology that aid with community project. And last but not least is capacity building. This is to evaluate and develop the abilities and expertise of the community members to create training, courses, and encourage involvement.
Rationale of conducting a community assessment of internationally educated nurses at Seneca College. First is surveys and questionnaires to gather quantitative data from IEN students, faculty, and staff. Next is institutional data and records to assess IEN enrollment, academic performance, and support service utilization. And the last one is collaboration with immigrant support organizations to gain insight into the broader community context, challenges, and potential areas for improvement. Internationally educated nurses face numerous challenges when transitioning to Canada, including securing licensure, demonstrating language proficiency, participating in bridging programs, acclimating to cultural norms, and navigating the complexities of immigration and work visas. First is language proficiency. A significant barrier is proficiency in the host country language, often English or French. Next is cultural adjustment. Adapting to cultural norms and expectation in the host country is crucial for effective communication with patients, colleagues, and healthcare professionals. The last one is immigration and visa processes. Understanding and adhering to immigration regulations are crucial for a successful and sustainable career. IEN immigrants face several challenges while pursuing nursing education in Canada. However, their experiences can be motivating for others. IEN bring diverse experiences to the Canadian healthcare system, improving cultural competence and patient care. However, getting their international qualification recognized and language proficiency can be challenging. These are the strengths: tenacity and determination. IEN newcomers display remarkable tenacity and determination in overcoming the various challenges they face in pursuing nursing education and licensure in Canada. Next is diverse experiences. This diversity enhances cultural competence among healthcare personnel and introduces new perspective and patient care. The last one is contribution to cultural competence. The international nursing experience of IENs contributes to improving cultural competence within the Canadian healthcare system. And these are the challenges or limitations. First is recognition of international qualifications. IEN often face challenges in recognizing their international qualifications in Canada. The process can be complex and time-consuming, involving a thorough evaluation of education and work experience. Next is language proficiency. Some IENs may need to improve their language skills to meet the required levels, adding a layer of challenge to their integration into the healthcare system.
Organizations and services for IENs at Seneca College. Language services. If English is not IEN's first language, there are ESL programs available to assist them in getting better at the language. Career counseling. Help is available with networking with possible healthcare companies, resume writing, interview preparation, job search strategies. Counseling services are available to offer for IEN's emotional and mental health help as they negotiate the difficulties of schooling and career adoption in the new nation. Credential evaluation support, assistance in navigating the requirements for international qualification recognition, as well as services to support IEN's the credential review process. Gatekeepers and stakeholders for IEN at Seneca College. College administration. Communicate the unique demands and difficulties experienced by IEN students to college administration. Faculty and instructors. Encourage interaction between the teachers and professors to make sure they are aware of the distinct experiences and backgrounds of IEN students. International Student Services. Collaborate closely with the Office of International Student Services to offer resources and information tailored to the needs of IEN newcomers. Healthcare employers and organizations. Open lines of contact with healthcare organizations and employers to learn about their needs and expectations when it comes to employing IENs. Regulatory bodies for nursing. Keep in touch with the regulatory agencies in charge of nursing licenses to be updated on any modification to the requirements for licensure. Voices that may not be heard regarding the integration of IENs. Internationally educated nurses themselves. It's possible that IENs' unique viewpoints, difficulties, and life experiences aren't properly taken into account when making decisions. Nursing associations. Although nursing associations have a significant influence on nursing standards and regulations, their viewpoints might not be completely taken into account. Healthcare employers and industry representatives. The underrepresentation of industry representatives and employees in the healthcare sector may have an impact on how well nursing education meets industry demands. Academic institutions that teach IENs might have perspective on the difficulties that their students encounter that aren't always completely included in larger conversations. And lastly is the patients and communities. When talking about how to integrate IENs into the healthcare system, conversations may not give enough weight to the opinions of the communities and the patients they served.
Involvement in the community assessment. Use specialized questionnaires and surveys to conduct community assessment for nurses with immigrant training. Distribute these via internet platforms and association. Hold focus group to obtain a qualitative information. Promote IEN involvement in committees that focus on integration in nursing association. Next is addressing diversity among internationally educated nurses. Enhance support for internationally educated nurses by implementing cultural competence training for staff, creating tailored programs for at-risk populations, and provide language assistance services to address linguistic diversity and potential barriers. Next is the strengths of the approaches. Implemented strategies bring substantial benefits. Inclusive programs prioritize cultural sensitivity for newly graduate internationally educated nurses, emphasizing skill development to enhance nursing proficiency and adapt to Canadian healthcare norms, addressing potential gaps in education or experience. These essential programs significantly boost IEN's confidence and preparedness, providing excellent opportunities for success in their new learning and work environments. Limitations. The identified strategies face challenges in addressing the diverse background of internationally educated nurses. Financial constraints is the number one, limiting further education for those with limited resources, and potential restrictions on participation due to family responsibilities.